Welcome back. You know, Father's Day is Sunday, and June is actually Men's Health Month. A reminder that men are actually less likely than women to get preventative care they need and ultimately have a lower life expectancy.
But there's some new approaches to primary care and that are trying to change that. Bradley Blackburn has more on what men can do to improve their own health.
Stephen Bachgalupo is a model patient. Every year, he comes to NYU Langone's Tisch Center for Men's Health for a checkup with Dr. Stephen Lamb.
Would you say your health is pretty good?
I think so.
The 43-year-old is serious about his health because he wants to be there for his wife and son. His own mother had diabetes and passed away when he was just 26.
That's always in the back of my mind. So certainly I want to do what I can to minimize any repeat in that history.
A long, healthy life starts with prevention. And that's why Dr. Lamb helped create this center that puts primary care, labs, and specialists all under one roof that's tailor-made for men.
A lot of men don't appreciate that you're planting the seeds for your future wellness in your 20s and 30s. And so if you take really good care of your 20s and 30s, you have a chance of not living to 50, but living to 90 or 100.
Heart disease and cancer are leading causes of death for all men and are often preventable. But surveys show more than half of men don't get regular health screenings, and numbers are even worse for men of color.
As you get older,
Dr. Lamb says a regular checkup can keep you on track, even if it's not necessarily once a year.
At some point in your 20s, you should have a visit. All right. I do think you can set the standards for that individual, whether they need to be seen in a year or 2 years.
As long as my health is good, we'll keep it at once a year.
An ounce of prevention only works if you take it.
Just get that checkup.
And the hope is that more men will put their health first. Bradley Blackburn, CBS News, New York.